Good afternoon, my name is Bonnie Santos and I'm a student at William Peace University. I'm here today to discuss why you should vote in favor of medical marijuana. What if you had a toddler experiencing multiple prolonged seizures each and every day that not only caused developmental delays, but also had potentially fatal consequences? What if I told you you could find additional funding for your overcrowded, underfunded schools? And you could see your community's drug-related charges drop by 23%, freeing tax dollars spent for processing those criminals. I know this sounds too good to be true, but Colorado found a way. I spent time studying the benefits that Colorado has seen since passing a law in 2012 legalizing marijuana. Legalized marijuana has more benefits to offer today's society than it has drawbacks. It's a natural source of alternative medication. It provides additional tax revenue to fund schools, infrastructure improvements, and help the homeless, and frees up justice resources and space in overcrowded prisons. For the ACLU, federal law states that marijuana, medical or otherwise, is strictly against federal law. This is where you get to speak up. Per USA Today, medical marijuana is legal in 29 states and the District of Columbia, our nation's capital. North Carolina is not one of these states, and when it comes across our ballot, I want you to get out and vote. Meet Charlotte. Business Insider published an article titled 23 Health Benefits of Marijuana. In this article, I met Charlotte. She was the subject of Dr. Sanjay Gupta's documentary titled Weeds. Charlotte is a Dravet syndrome patient. This is a very rare seizure disorder affecting toddlers. She was experiencing 300 or more seizures in 1 week. A strain of marijuana high in cannabidiol and low in THC lowered her seizure count to just 1 seizure per 7 days. The cannabidiol quiets the excessive activity in the brain that causes Charlotte's seizures. Autoimmune patients also see benefits. It quiets their immune system, which causes the issues that they experience. And multiple sclerosis patients also see their pain and muscle spasms decrease because the marijuana binds to the receptors in their muscles and nerves. 22 veterans a day commit suicide because of PTSD after coming home from a war. The THC in marijuana helps regulate the system that controls fear and anxiety in our bodies and brains. Imagine the lives that marijuana could save when being used to treat veterans. Do you know the hell that we call chemotherapy? Do you know anyone that's been through it? Unfortunately, I have, and I'm sure many of you know someone as well. Helping patients who are undergoing chemotherapy is the most common use of marijuana. The Huffington Post interviewed Jeanette Buckland, a nurse who used medical marijuana to get herself through chemotherapy. Let's let her words speak for themselves. At one point, many months into my treatment, I was ready to quit. Marijuana took away my nausea so I could eat healthy. It took away the severe restlessness and anxiety so I could relax. It allowed me to eat, sleep, and be up and active when I was awake. It didn't get me high. It made me feel halfway normal. It gave me the strength to continue with the chemotherapy when I had reached a point where I really couldn't tolerate it anymore. So you don't need medical marijuana? And you don't want to vote for it? Do your schools need additional funding? Does your community need improvements to its infrastructure? Is there an issue with homelessness? Let's take a look at the additional funding raised in Colorado and Washington state. NPR explores Colorado's marijuana law that was passed in 2012. It didn't take effect until 2014, but in 2015 alone, Colorado raised $135 million in tax revenue from marijuana alone. The projections for this year, 2016, are between 150 and 170 million. Voters were promised that the first 40 million would go towards building schools, but the individual towns are using it to help the homeless, improve their infrastructure, provide scholarships, and drug intervention programs. It doesn't just bring in extra revenue. It saves taxpayers money. Since 2014, marijuana arrests dropped 80% according to the Drug Policy Alliance, and all drug-related arrests dropped 23%. This means less inmates to feed and shelter, less police officers spending their time dealing with minor crimes, and less judicial time. Those with minor arrests may not be considered employable. Those that are employed may be overqualified for their current job. Legal marijuana means clean slates for these people. It means a lower unemployment rate, which automatically increases the tax revenue. And those that are overqualified for their jobs can now find higher paying jobs. And that, again, means more tax revenue. As with many drugs on the market today, treating diseases and boosting the economy comes with a price tag. Business Insider states that overuse and abuse can lead to dependency. This risk is not unique to marijuana. Our country has a serious problem with prescription painkillers. Let's take a look at the rate of overdose deaths in America. That red line is deaths from overdose caused by legal opioid painkillers. The green line that stays at 0, that's the 0 overdose deaths caused by marijuana. In conclusion, I hope I've brought to light some issues that you haven't taken into consideration when presented with the option to legalize marijuana. Marijuana may not benefit you medically, but it can be a lifesaver for those inhibited by strong, possibly addictive drugs. But it can also help your community by creating additional tax revenue to fund schools and other important projects, as well as reduce the strain on an overwhelmed justice system. So when your ballot comes with a choice to legalize marijuana, make sure you check the box. If not for yourself, then for the parents trying to save the lives of their toddlers. Thank you.